I will always fight good and hard even if I have to fight alone. Susan LaFlesch Picotti. Welcome back, everyone. As we continue our celebration of the women who brought us to today, we celebrate the accomplishments of Susan LaFlesch Picotti for Women's History Month. She was a strong, independent woman in a time when neither was seen as desirable or really even welcomed. Susan was born June 17, 1865, on the Omaha Reservation in northeast Nebraska. Susan's father, Joseph LaFlesch, also known as Chief Iron Eye, led the Omaha tribe with the help of his wife, Mary Gale, or also known as One Woman. The Omaha are a peaceful people who lived by agriculture and hunting. The name Omaha means those going against the wind or current, which refers to the migration of the people up the Missouri River. The LaFlesch family focused heavily on honoring their culture while learning about and appreciating other cultures. When Susan was a young girl, she witnessed the death of a tribal member because an agency doctor chose not to treat the elderly Omaha woman. Susan later wrote, quote, "I saw the need of my people for a good physician," end quote. So Susan set out to learn all the skills she needed to help. She spoke Omaha, Oto, French, and English fluently. Susan attended the Hampton Institute in New Jersey at the age of 14 to continue her education. She applied to the Women's Medical College in Pennsylvania, which was a bold move at the time, given most women were sent to college to learn housewifery skills. You see, medical doctors during this time claimed that higher education would cause women to become infertile and their smaller brains would not understand the content of the courses. Susan not only graduated, but she graduated 1 year early from the Women's Medical College of Pennsylvania in 1889, becoming the first Native American to earn a medical degree. Following graduation, Susan completed her residency on the East Coast. Now Dr. Susan LaFlesch returned to Nebraska to practice medicine. She was 24 years old, unable to vote, and in charge of the care of 1,200 people during a time when antibiotics were not widely available. The LaFlesch family focused heavily on honoring their culture while learning about and appreciating other cultures, as they saw that this was the only way for their people to survive. Susan honored her family tradition by never turning away any patient. She said, "My office hours are any and all hours of the day and night." In 1894, Dr. Susan LaFlesch married Henry Picotti and settled in Bancroft, Nebraska to open a clinic serving local Native Americans and European immigrants. Dr. Susan LaFlesch Picotti witnessed the changes of the health of the Omaha people caused by living closely to European immigrants. The immigrants brought alcohol, tuberculosis, cholera, and many more diseases that have been unseen to Nebraska. Dr. LaFlesch wrote to the Commissioner of Indian Affairs to take action to educate the residents of the Omaha Reservation about preventative practices. This is where we come to public health and why we are so honored to tell Dr. LaFlesch's story. Susan LaFlesch advocated for the prevention of disease rather than the treatment of disease after the fact. She encouraged her patients to practice hand washing, install screen doors to their houses to prevent pests, and to limit alcohol intake. In a letter to the Commissioner of Indian Affairs, she wrote, "My work as chairman of the State Health Committee of the Nebraska Federation of Women's Clubs for 3 years brought me a great deal of information as to the latest and more efficient methods of preventing the disease and caring for the sick. I have conducted a public city campaign among the Omaha by families and individually, but I find it just the same among them as among your people. Eternal vigilance is possible only where you stand a trained nurse over them." Dr. LaFlesch opened a hospital in Walt Hill, Nebraska in 1913 to increase access to health services in the area. At Two Rivers Public Health Department, we strive to carry on the work of Dr. Susan LaFlesch as a public health leader in Nebraska. We hope to prevent illness in the future and give back to our communities as she did. Until next time.